me 1 second here. Let me see if I can get my list of folks. I'm sorry.
Just past the, Bourbon Street. Yeah. Now I'm like.
No worries. Just it was kind of a last minute change in plans, so let you give you a few minutes to get organized.
Okay. Actually, if someone could, because I'm on an iPad, so I don't have a lot of screen space here because I'm traveling today. If someone could get a list for me so I don't have to dig it out through email, that would be great. A list of attendees, and we can go through that. I'll just sort of call names of folks who are here, and then if we could determine who's not here, that would be great. So it appears that Jackie is here.
Hi. Yes.
Arlia and Jessica from the board are here, or not from the board, from the county are here.
Yes,
Gail,
and Ashley will be
you're
joining here shortly, Kim.
Okay. Shane is here. Tom is here. Our guest, Dr. Velasquez, is here. Velasquez. It looks like Amanda from Molina is here. I'm seeing Jamie here. Katie Rice is here. Chris Thompson is here. Liz is here. Madison and Nancy. Is there anyone that I've missed? And again, I apologize, I don't have that list in front of me.
Did you call Gail?
Yeah, Gail is here.
Okay, perfect. Okay, well, if everyone would please take a look at the meeting minutes from a couple months ago for any changes or edits.
I motion to accept.
Thank you, Shane. Can I have a second?
I'll second.
Thank you, Gail.
Oh, Gail.
All right. All right. Anyone abstaining or have any changes? Otherwise, we'll assume it's approved.
And Kim or Arlia, do you know if we, or Nancy, do we have a quorum today? Because I know that we were going to vote on.
Yes, we do.
Thank you, Arlia.
Perfect.
And I wrote back, you're not ready for this.
Okay, let's go ahead and accept those. And again, give me just a moment to look at my agenda.
No, round table, Dr. Velasquez.
Yeah, I believe Dr. Velasquez is here to give us all an update on how things are going with the fentanyl roundtable.
Perfect. Actually, Dr. Velasquez, let's go ahead and turn things over to you. Thank you.
So good afternoon, everyone. And Madison Johnson is here from our team because she has the extra presentation. And there seems to be a live mic somewhere. It's on me. So thank you for the invite. And I'm here to tell you a little bit about the Fentanyl Roundtable. There are a couple of members of this advisory board that participate in it. So I appreciate their support. I have about over 30 slides, but I'm not going to go in detail in all of them. I do that mainly so you have all the content to for you to refer to it afterwards if you need to. So let's go on to the next slide, Madison. And you probably haven't heard much about the Fentanyl Roundtable, but I'm going to give you a little bit of perspective of why we started this. Next one, please. So when we talk about history between 2018 and 2019, we started to see around the country a trend of significant increase in synthetic opioids as opposed to prescription and others, as well as the rise of fentanyl. This is a graph that depicts the country about 2020. Next one, please. So when we look at that trend and look at the state of Washington, we started to see the same thing. This graph is really good because it tells you a little bit about the history of how we've had three waves of opioids, basically prescription, heroin, and now basically fentanyl, a number of the other synthetics. And this goes up to 2022. So this is the state of Washington. Next one, please. When we look at what does that mean in the recent past is we've had an increase in the number of overdose deaths related particularly to fentanyl. Although in a few minutes, I'm going to tell you it's not just fentanyl, but fentanyl is kind of like the umbrella that we use for all of those because this is actually the most common drug. And one of the things we've seen in the press over the last couple of months is that there's been a little bit of a decrease at a national level, and we're starting to see a little bit of a plateau in the state of Washington. If we go on to the next one, please. We have not really seen that plateau in Spokane County. These are the numbers up to 2024, which the medical examiner just released in the last few days. And actually, the medical examiner, Dr. Singh, had come to the fentanyl roundtable a couple of weeks ago to give you a little bit of an update. So I have a couple of her slides. But as you can tell, we have continued this steady trend in Spokane County. These are the numbers from the medical examiner as of basically Friday or Saturday of this past week. Next one, please. Now, one of the issues is, though we talk about fentanyl, and still 60% of more of the overdose are related to it, we're starting to see an increase in a couple of the other drugs that had gone down over time. And if you look at this graph, methamphetamine is the most commonly detected drug after fentanyl. And that is the orange color that is going up. We're also seeing cocaine and a number of other combinations, including therapeutic or prescription drugs, as well as over-the-counter drugs. And I'm going to show you a few of those detected in addition to fentanyl. The reason why I bring that up is because one of the concerns is what are the drug interactions, as well as what can some of these other drugs do to the individual in addition to whatever fentanyl is doing to the individual. And as we've seen with drugs that have been discovered more often in other parts of the country, like xylazine, is not reversible with Narcan. Although we haven't seen a lot of that in Spokane, which is good because that's if fentanyl is terrifying, xylazine is a little bit more terrifying than fentanyl. Next one, please. So one of the concerns that we have talked about over the last few years is the significant increase in substance use in youth and young adults, particularly 14 to 18, K through 12, basically, folks that are a little bit older. But although we do talk about youth and young adults and the use of drugs, including fentanyl and other compounds, if you go on to the next one, please, an interesting fact is that over the last few years, we've seen that age group over 50 to increase also significantly. So this is not just youth and young adults. We have folks up in their 80s in which we have seen overdoses as well as in the 70s. Now, a couple of reasons for that. First of all, the average lifespan is increasing. We're all living a little bit longer. And second, we have seen some of those that may have started younger continue to use and have transfer from one substance to another. And now we're seeing the effects of that, as well as the fact that if you think about things like social isolation and loneliness and so on and so forth, there is a correlation there with mental health, behavioral health, and also substance use that comes with those that are later youth. I don't use the word senior because it sounds old. So those that are over 65. Next one, please. Interesting enough, if you look at the location, and this from Dr. Singh, our medical examiner, we still see the vast majority of the overdoses, at least 2023, I think is going to be very similar for 2024, happening in dwellings, although the number of overdoses we're seeing motor vehicles is increasing. A motor vehicle can be everything from a car to a camper and everything in between. So we're seeing, and if you drive around town, you do see a lot of RVs and vehicles of that nature parked in various and sundry places. Next one, please. Now, about 2-3 years ago, we started to talk a little bit about one of the most significant trends that was of concern and continues to be of concern, which is the counterfeit drugs or pills. Basically, you may buy through the internet or any other means, and I'm going to show you a little bit of that, what you think may be an oxycodone or oxycodone, and it's not. And the rationale behind that is those folks that manufacture these illicit drugs have found that counterfeit pills are a very good market. And actually, in some of the DEA raids that we've seen across the country, they've actually been able to retrieve some of the seals that are used in the actual pharma companies to market these pills. So it's a very interesting business. Next one, please. The concern with that is, there you go, that is the market is fairly broad and includes prescription medications that are commonly acquired online by the age groups that we're talking about, 14 to 18, as well as some of our later youth. Next one, please. In addition to that, one of the trends that we have seen, particularly over the last year and a half or so, is the polysubstance composition of many of the pills and powders that are being purchased on the street. Basically meaning they were not pure to begin with, and the pharmacology behind them was somewhat unpredictable. Now it's even more unpredictable because a lot of things are being added to it as components to everything from caffeine to Benadryl and everything in between. If you look on the far right side, you're going to see some of these compositions that have a long list of chemicals. And again, the more chemicals you add, the less predictable the outcome could be for the individual, because we don't really know how all of these things interact with each other. One of the theories behind the use of Benadryl is that because it slows you down a little bit, it kind of masks some of the effects of some of the other drugs that are more of a stimulant. That could be a downside because you can be overstimulating your heart and not know about it. Next one, please. A couple of years ago, a trend that was extremely worrisome because it came around Halloween actually was the rainbow pills. And if you think about it, one of the target segments that seems to be pursued is younger than 14. And if you think about all the things, they look like Skittles. Next one, please. Bottom line is one of this, doesn't matter which one it is, can kill you. About 6 out of every 10 counterfeit pills has what potentially lethal dose of fentanyl at this point in time. Now, the interesting thing is we've gone from injection to mainly smoking. And the reason why I'm showing you vaping on this slide is because vaping is also becoming a vehicle for introduction of fentanyl in some of those that may be inadvertently using fentanyl and don't know about it. Now, next one, please. If you look at the previous slide, just to give you some perspective, that is the point of a number 2 pencil. And that tiny bit is enough to kill you. And actually, the sugar packets that you get at the coffee shop, anywhere, one of those can kill about 60 people. Just to give you some, if that was all fentanyl, it could be a lethal dose for about 60 people. Next one, please. One of the concerns over the last few years has been the connection between some of these illicit drugs and social media. I'm not saying anything negative about social media, but it is an acquisition vehicle, particularly Snapchat and others. And we do have to find a way to make sure that that is not a vehicle of access for some of these counterfeit pills. Next one, please. The interesting thing is that it doesn't seem to be that difficult. This is not my phone, by the way. This is actually a snapshot from the DEA, but you can actually go on your smartphone and get all kinds of things, which is the main way that all of these kids or youth and young adults, should not call them kids, youth and young adults, are accessing what they think may be counterfeit pills or maybe original pills, but they're actually counterfeit pills full of fentanyl. Next one, please. These are some of the emojis. It gets very sophisticated. Interesting though, the high potency has a bomb, which I think is apropos. Next one, please. So in 2020, because of all of these conversations, I had the opportunity to write this article for the County Medical Society. I'm happy to share that with you. It's still pretty useful. And next one, please. As a result of that and a few other conversations, I was asked by Senator Cantwell if I will moderate a conversation in the community in terms of the impact of fentanyl around the country. That was in 2023. This was actually in the Spokesman Review. That was the cover. And we brought together a large number of people from multiple areas of the community. And as we were listening there, it became apparent to me that all of these folks had something very important to contribute to the conversation, but most of us had not been in the same room at the same time. And most of us had not been able to have conversation with each other. So I leaned over to the senator and asked her if she would mind if I kind of took this effort off the table and went separately and brought everybody back together to talk about what can we do as it pertains to the fentanyl issues that we have in the community. Next one, please. And that was the beginning of the fentanyl roundtable. I'm going to show you the first meeting, but here, just to give you an idea, as we were all talking in that room, there were a number of areas of commonality of purpose that are still valid to this day. But there was a lot of conversation that was somewhat generic, like we need more detox facilities, we need more bed capacity. So my question was, bed capacity, what kind of bed capacity for what? That comes from my previous foray as a corporate executive, as CEO. I tend to be very specific. To be able to define exactly what we're looking for. But there was a commonality in all of these topics. Next one, please. So the initial areas that we as a group decided to take a look at, reimbursement, justice system as a partner in the continuum of care, because it is part of the continuum of care. What is the scope? Focus on K through 12. And actually, when I tell you about our youth and young adult work group, they're going pre-K now. And I know it's kind of scary that we have to talk about pre-K, but we do. Why? Because given the availability in social media and other markets, pre-K children are being exposed. So next one, please. So we came together on October 2023. I can't believe it's been that long. And this, the composition of the roundtable is actually fairly broad. We have public health, healthcare service providers of all kinds, mental behavioral health providers, specialty services, tribal partners, faith-based, people with lived experience, law enforcement, justice. We have 2 judges in the roundtable. Emergency medical services, fire departments, all 13 fire jurisdictions have participated. Nonprofit organizations and City of Spokane, Spokane County, and Spokane Valley have come to the table. And our discipline is we are looking to define actionable items that are quantifiable and can be delivered within a reasonable period of time without overlapping or duplicating services that others are providing. Next one, please. So we went on a journey around the country to learn what others are doing and how that has that work. And I just have a couple of highlights here for your references. For example, the state of North Dakota that actually figure out how to reimburse non-traditional, non-licensed providers through legislative action that allows them to get the equivalent of Medicaid reimbursement. And the reason for that is because non-licensed providers like peer counselors, peer navigators, typically don't qualify for reimbursement, but they provide a significant amount of service. And the state of North Dakota managed to bring these folks on board and all of a sudden open capacity for an extra 5,000 patients with the stroke of a pen, which I think was, so we have the full model. And when I say we have the full model, at the roundtable, we record all the meetings and we have an electronic archive of every presentation, every paper, every document that has ever been given to us. So we're happy to share that with anyone that is interested. Next one, please. So we've looked at a number of states, and actually, if you look at Kentucky on the far right, mean age 36, and I want to highlight education and employment. One of the areas that is critical adjacency, a lot of these folks that may have been involved in substance use when they become sober and go through recovery, one of the issues that we can find is they don't have either education and or marketable skills that allow them to get a job. So we need to think about things like education training, job training, and providing them with marketable skills. So things that we may not think about that are part of the continuum, but if they don't have that, then the recidivism is extremely high. Next one, please. This is from Bergen County, New Jersey, and this proved the point of what we call high impact individuals. This is the journey of one individual over about 4 years from being a public nuisance, kind of an annoying person, all the way to an overdose. And each one of those dots and the lines are encounters with different services, agencies, enterprises, nonprofits, et cetera, et cetera, et cetera. And the point behind this slide is that one of those individuals, one of those high impact individuals, and we don't know exactly how many we have in Spokane, but it goes between 60 and several hundred. We don't know exactly. This individual disproportionately used services. And one person, if we don't intervene early enough, will end up costing millions and millions and millions and millions of dollars. So the project that administrative action that the mayor took a while ago to look at high impact individuals in the core of downtown is looking at how do we provide case management and the appropriate navigation to actually intervene early and move them on. So one of the reasons why we did not look at this in more detail, because the mayor with her action was actually doing something like that, so we just support it. Next one, please. One of the areas that we looked at, which is a good model, we're still talking about it, is San Antonio. If you know, San Antonio had two models that were complementary. One is the Haven for homelessness. The other one is the Stabilization Center. Next one, please, which is specific to substance use. The Restoration Center on the far right of the slide, that little building over here, was the beginning. And basically, that's an early intervention that allows law enforcement to bring someone, as opposed to bring them in front of a judge or to a correctional facility. They go into this restoration center where there's a triage. By now, they have a full campus that, as you can tell, includes everything from housing, because housing is one of those triggers, or lack of housing thereof, particularly with younger people. So they have tried to address those areas that will cause what we call a drop-off. I have a contact with, and then I drop off of the system, end up back on the street. It could be healthcare, EMS, it could be law enforcement, it could be justice, it could be a lot of things. For example, for women that are pregnant, a lack of prenatal care is a trigger for recidivism. So if you want to address that, then we're going to have issues. Same thing with primary care. There's a model in San Antonio, which is known as the Restoration Center. And the folks in San Antonio have been here a couple of times. We had the opportunity to talk to them. Now, in Spokane, we may not have a campus like this, but we have pieces of this. Question is, how can we better coordinate the whole thing? Next one, please. So this is just some of their quantifiable results. On the far left, how do they justify the whole thing? Well, because it takes about $350 over there in the restoration center, as opposed to $2,000-3,000 in the jail. And they've saved more than $10 million per year over the last many years. So they've been doing this for a while. Next one, please. So on April the 10th, our Fentanyl Roundtable asked, we do need to have a map of our community behavioral health needs assessment. Basically, what do we have and where is it and what does it do? So the team at the data center in the Spokane Regional Health District came together, and next one, please. Delivered through resource mapping, which is a process that has been used broadly around the country. Next one, please. Delivered this actually it's on our website. You can go and look at it. It's a site that basically has all of the services for prevention, treatment intervention, harm reduction, overdose and death, and supporting recovery. Next one, please. It's interactive. So the way you go to Country Health Insights, and you click on one of these boxes, depending on where you're looking at and where you're looking at it. Next one, please. and it gives you the detail of what happens there and who does it. There's a lot more detail on the website, but this is just to give you a perspective. Next one, please. So that is live and has been live. After that, we decided to focus on 3 areas specifically, because again, our discipline is to be narrowly defined actionable items. We're not going to solve everything. So we are focusing on reimbursement. I'm going to show you a little bit of what that looks like, on post-system care, which is bridge or recovery housing, particularly for youth and young adults, because lack of housing is again, is a trigger. And then the youth and young adult prevention. And as I mentioned, we're going beyond K through 12 down to the pre-K era. And I know it's scary, but we have to do it because of the exposure. Next one, please. So our reimbursement work group kind of built this map to look at what are the pieces of the puzzle and what does that have to do. But as they were looking at the pieces of the puzzle, they determined that for us to be successful, next one please, we need to start breaking it down by age groups, and then look at each one of the specific issues behind each one of those, including defining all of the barriers. And I know barriers, there's a lot of them when we look at age groups, but 0 to 26 is youth. Next one, please. Second group that we're looking at is Part A adults, and these are adults 26 to 65, and these are specifically those that are basically homeless. Next one, please. Second part of that is those that are not homeless, those that are working. I'm going to stop here for a second, because we have this vision that people that are dying of overdoses somewhat out on the street. That's not the case, as we already pointed out. And one of my biggest concerns is not those that are highly visible, that are on the street and we see them. My main concern is what's hidden in plain sight. A lot of people that are either using substances right now at home have never had an encounter with either an emergency room, EMS, or the justice system or law enforcement. And those youth and young adults that are gateway vaping going into. So that's what worries me a lot more, because those are the ones that we don't know about. Next one, please. So we also have to worry about seniors. They use the term seniors, although I do use it, later youth. And the reason for that is because 65 plus is becoming a growing trend in our community. And as you know, Spokane County has a large population over 65. By 2032, 65 will surpass 18 and under. So we're going to get a little bit of inversion of the curve, not like they have in Japan, but something along those lines. So this, just to give you some idea, the detail that these work groups are getting into. I wish I had a summary from our youth and young adult, because they have a long list of opportunities they have identified and a long list of barriers. Next one, please. So with that, I'll stop here, see if you have any questions. I know I only had, I think, 15, 20 minutes, so I've been trying to be mindful of that.
Dr. Velasquez, that was really interesting. Thank you very, very much. Questions for Dr. Velasquez?
Hi, this is Gail Kogel. I have a quick question for you. When you were talking about the increase in vaping as a method of ingesting these medications. And I remember a long time ago that when people were mainlining or shooting up or IV use of opioids, that they were made into a formula that rendered them almost unable to be injected. Is there any way that you can do that with, I don't know that it can, I don't know if you put a non-combustible in it or what, but I don't know if there's any thought to how the tablets or the pills are being constructed. No, I just answered my own question. The counterfeit ones won't even care. So I guess that's a moot point. Never mind.
Yeah, but one of the concerns with the vaping is that the injection of fentanyl liquid into the solutions. And if you look at all of these solutions, the things that mimic like Fruit Loops and everything else. So it's kind of interesting. Good question.
Dr. Velasquez, thank you for your slideshow and all the work that you do. It's amazing. How do I get in contact with you? Do you have a phone number that I contact through the health department to get hold of? I'd be interested in getting on your fentanyl roundtable.
Sure. So I'm glad you brought that up. Our fentanyl roundtable is open. We actually continue to add members, and Madison Johnson, who is here with me, coordinates the roundtable. So as long as she's got your email address, we can send you an invite. And by the
Yeah.
way, the invites right now, the invitee list is about 75 people. Not everybody not everybody shows up every meeting, but
Mhm.
the reason why we keep this broad list is because we do share meeting notes from each one of the meetings, and people have access to the slides, people have access to the material. So if for another reason that is a good place to find a lot of information, it's good to participate. So Madison, if you could if we could get your email, if somebody can send that to Madison. Here it is. Okay, thank you.
Yep. Yeah, I would love to get involved. I did the state of substance abuse in Spokane years ago, and the police chief and them and many of the other people in the community stakeholders are wanting to do that again. So I would love to coordinate with you
Um,
to put something like that on.
Sure, and from the roundtable, Ashley participates. Under Sheriff Thompson participates,
Mhm. Mhm.
and where do you, Jessica participates. So as well as other. But any other questions for me? I really want to be mindful of your time. I apologize if I went a little bit over.
I want to ask you one question. Is I'm out on the streets like 5, 6 days a week with the homeless early in the morning, and one of the things that has been happening recently, I don't know if you guys study what they're breaking down the fentanyl with to extend it, but it's causing all kinds of nervous disorders and infections in the people that are using the fentanyl. Have you guys been able to break down what the latest substances that they're using?
I don't have that information, but I do know the medical examiner has some of that information. And if you recall one of the slides where I was pointing the various substances in the street,
Right.
a lot of stuff is being put into those. Everything from, like I mentioned, caffeine, Benadryl, all kinds of stuff is going into it to make it look more. But we may need to get that information directly from the medical examiner, which I'm happy to get.
Thank you.
Yeah, thank you, sir.
Other questions for Dr. Velasquez? Again, thank you, sir, for the information. That was really, really useful today. We hope to have you come back again soon and update us with the roundtable's continued work. So thank you very much.
Thank you. My pleasure. I appreciate the invitation. So Madison and I will depart if there are no further questions for us. And you have the presentation. So if you have any questions afterwards, just send me an email.
Okay, thank you, sir.
You have a great day. Thank you. Bye.
Yeah, thank you, Madison. Okay, let's move on to some administrative updates. It looks like Ashley has entered the room, so to speak. So Ashley, we will turn it over to you.
Hi, yes, thank you, Kim, and good afternoon, everyone. Apologies for being a little bit late, but I knew Jessica was there ready to provide some updates if I wasn't available. Just wanted to provide some updates as it pertains to our crisis system with number 1 and number 2 on the agenda. The first one being the crisis response triage and mobile dispatch unit. In the beginning or in the fall, Department of Health and Healthcare Authority did come out with a joint policy statement pertaining to the future state of 988 and regional crisis lines and what they envisioned. And that future state, as they envision it, would be that 988 would be the entry point for help seekers, individuals seeking assistance in our community, an easy to remember 3-digit number, whereas the RCL, the future state as they vision it, would be more geared towards professionals being able to access dispatch for mobile crisis teams responding in the community to provide those crisis services to individuals needing that level of care. And so Spokane County, our Spokane Regional Service Area, we are very unique in the fact that our 988 provider and our regional crisis line provider is the same provider, which gives us vertical integration. And with that, we have been in the plans and working with that provider to see how can we streamline those processes and ensure that there isn't duplication of services happening at the same time. So, not having a RCL line and a 988 line by the same agency doing the same similar processes, but having double the staff do that. And how can we better align things to be able to more rapidly respond to individuals in the community? So with that came the Crisis Response Triage and Mobile Dispatch Unit, more commonly referred to as the Mobile Dispatch Unit. And so with Frontier, we did start a slow phase transition beginning in December, apologies, with this unit to start staffing up some of the daytime hours of their availability to do that exact thing, which is streamline that process for individuals calling to be able to utilize 988 currently, and it will continue. The RCL number and 988 will both be available. However, trying to gear our community more towards having 988 be the entry point for individuals seeking that care, because sometimes that can just be phone engagement and services and supports, and sometimes that is needing that response. And having that 988 clinician being able to transfer that call to the mobile dispatch unit, who can more rapidly assess what teams are available, where they're available, and get someone out there sooner to that individual seeking care. And so just wanted to provide an update that process has begun. It's going to be a tiered and ongoing process that is evaluative as we start adding more shifts to that, seeing what tweaks and adjustments need to be made through that process. And I'll pause here if there's any questions on that.
Ashley, is that going to be what, replacing the MCAT?
Not the MCAT. So the MDU, the mobile dispatch unit, will be a unit that can also respond, but primarily will be focused on dispatching. So RCL 988 calls, when they determine that someone needs that in-person response, they can more rapidly send them over to that team to connect them with the response that's going to be responding, versus having to stay on the line and kind of determine what team is best available and what meets the needs of the individual, which makes them more available to answer continuing incoming calls.
Thanks for that clarification.
Absolutely, Gail. And we'll be continuing to provide updates on this throughout that process, of course, as we're kind of the first region in the state to have a vision for how that looks moving forward. And again, that's partly because of our unique vertical integration with 988 and RCL provider being the one single provider. We don't want to lose that regional component that comes along with the regional crisis line and the relationships that's built over the years and the trust that the community has in being able to access that line and that number for a response, but just ensure that we're streamlining approaches to better be able to respond to individuals in the community and on the phone.
Nicely
that's
done, Ashley. Nicely done. That's interesting that we're the Spokane is the leading area in the state for this. Nice.
Absolutely. It's an exciting time. I think a lot more questions will probably emerge through that work. I know Department of Health and Healthcare Authority are working simultaneously together on a partnership for how that will look across the state, and I think are very interested to see how that's incorporated in Spokane. Obviously, that's going to look a little bit different for each region. The next update I have is related to our mobile response and stabilization services team. If you recall, this is a team we've discussed previously, and this started as a result of a SAMHSA grant in partnership with the Healthcare Authority and has been operated under Frontier Behavioral Health to provide extended services to youth and families after a crisis event, which allows them to provide stabilization services for up to 8 weeks following that initial contact to help a family and youth be better supported in their environment, get those connection to ongoing services established, and help prevent continued episodes of crisis if the baseline functions that are impacting their ability to stabilize are not addressed. So that team continues to operate. We did not continue with the SAMHSA grant starting in September, which was the end of the federal fiscal year, because we had built that into our crisis system. The state built it into the state plan amendment. So taking that on as a service that could be provided through managed care organizations, and that is being delegated through our crisis system from the managed care organizations to us currently. And so with Frontier Behavioral Health operating that team, they were operating that in conjunction with their child, youth, and family mobile crisis team. Though that service was streamlined for the youth and family receiving that service, on the back end, there was a lot of disconjointed parts of it in terms of funding and reporting and build out. But now, because it is all incorporated under the same crisis system, those two teams are merging. So as of January 1st, the MRSS team merged into the child, youth, and family team, and they are now as a 24/7 operating team providing both crisis intervention and stabilization services for youth and families. And so I just thought that was an important update to be able to provide to this group here as we look towards crisis services. Again, nothing has changed about the services being able to be accessible and provided, except for the fact that our child, youth, and family team operates 24/7. And because of the grant funding that came associated with MRSS, we were limited hours of operation. So daytime operations and some evening, it was a tiered schedule, but now that team, that child, youth, and family team, is able to operate 24/7, providing both crisis intervention and stabilization services. And I'll pause here for any questions.
No, thank you for that update, Ashley.
Absolutely.
I don't have a question. I just want to say congratulations. Way to go and streamline, you guys. Way to go once again.
Absolutely. I think we're always looking for innovative ways to make things simpler, which can be challenging. By the way, that funding comes down in different parts of our crisis system has been built out throughout the years. And so if there's opportunities for us to condense and streamline those to make things more efficient, especially for the individuals being served, that is definitely our main priority. And the third topic here, I don't have a list of legislation that I will review at this point in time, but we have entered into the legislative session. I think this will be a unique session in the fact that there are budgetary concerns moving into this year. And so we don't anticipate to see a lot of bills, or what we've heard, a lot of bills that have high fiscal notes associated, bills that develop work groups or stakeholder groups to kind of discuss and plan out things. I think there's going to be some constraints in that area. And so we are tracking some initial bills that have come through, but because it is so early and some of those don't even have bill digest, which gives further information, I didn't want to bring anything too much to talk about because that could change. So the next BHAB, I will of course have probably longer list of legislative bills that are impactful to our behavioral health system of care. But I just wanted to let you guys know that that is something that we are currently tracking and assessing, and we'll bring that forward here in the near future. Any questions on that?
Yeah, Ashley, thank you. Folks, any questions for Ashley or additional comments? Okay, thank you.
Thanks, Kim.
Yeah. All right, let's move on in the agenda. Tom, Consumer Consultation Panel Report.
Yeah, I have here my consumer consultation minutes from November and December. First, I'll do November. This meeting, our guests were Kaylin Roy, liaisons of BHAB and CCP, and Gail Kogel, Office of Behavioral Health Advocacy. Brent Smith, CCP Chair, facilitated the meeting. Also attending were CCP members Tom Go, Sharon Smith, Robin Segner, Sarah Leake, Sophia Alexander, and Rose Plorde. The online November 2024 CCP meeting was called to order. The October 2024 CCP minutes were read and approved. There was no October Behavioral Health Advisory Board meeting, so this was not reported on. Discuss the CCP budget. We have approximately $183 left in the budget. We decided to use this, purchase new CCP t-shirts. Under new old business, it was noted that Gail is moving to a new office on West 312 Sprague. This office has a boardroom which will be available for CCP meetings. Our office still needs new furniture. There will be an open house for the office on January 10th, 2025. Robin then said that she has put up CCP Santa picture flyers on the CCP Facebook page, which members can share. It was noted that EW is passing out flyers, and there are flyers at Evergreen Club and Spokane Community College. Brent said they did a trial run on his computer to prepare for the event, and that is ready to go. This year we will be doing grid photos as well as Santa pictures. The event will be held on Saturday, December 7th, 2024 from 1 p.m. to 3 p.m. at Brent's Church, the Audubon Methodist Church. The church is located at 3908 North Driscoll, the corner of Garland and Driscoll. CCP members should arrive by 11 a.m. Brent said that he will bring a backdrop for the photos. However, we still need candy canes. The next CCP meeting will be held online on Monday, December 9th, 2024 from noon to 1 p.m. Meeting was adjourned. Here's my minutes from December. At this meeting, our guest was Kaylin Roy, a liaison of the BHS with CCP. Brent Smith, CCP chair, facilitated the meeting. Also attending were CCP members Tom Go, Sharon Smith, Robin Segner, Sarah Leake, and Rose Plorde. Gail Cole had an excused absence. Sophia Alexander was also absent. The online December 2024 CCP meeting was called to order. The November 2024 CCP minutes were read and approved. We discussed the November 2024 Behavioral Health Advisory Board meeting. At this meeting, there was an administrative update by Justin Johnson, Ashley McGee, and Jessica Thompson. First, there was an update on system changes for January 1st, 2025. It was mentioned there will be a team on OPOINT funds. There was a question as to whether the regional health jurisdiction should look at all health or if this should be separate from substance abuse. It was mentioned there will be a drop-in center for substance abuse, the Starbrain Center for infants with substance abuse issues. It was mentioned that Spokane leads the way for the open situation. There was a presentation on the youth respite and expanded inpatient, 50% PFL, I believe. PFL has to do with federal poverty level. There was an increase from 20% to 350%. It was mentioned that there will be a Spokane Regional Crisis Stabilization, Spokane Regional Youth Crisis Stabilization Center. Clients will be covered for screening. There is a request for proposal for youth and adolescent respite. The respite center will provide game services and support, etc. It will be a safe place for youth to go. We then discussed the CCP budget. The remaining budget is $183. We intended to use this for new CCP t-shirts, but Sarah hadn't heard back from the t-shirt people. She may have to look somewhere else. If the CCP doesn't get shirts, we can use this money for Jaunt and June prizes. Jaunt is a walk-in event put on by the CCP. It was mentioned that the CCP Santa Picture event brought in $55 and that Brent's Church, Audubon Methodist Church, is a good location. We had pictures with the Grinch and Aaron's dog Clark also. It was suggested that if Brent's Church is the location for next year, we should distribute leaflets around the church neighborhood to advertise. Church also has a fireplace which serves as a good backdrop for the photos. Rose Plorde then read a letter about PACE, People Accessing Careers and Education. This program is at SCC. It stated that PACE program may be discontinued on June 12, 2025 due to budget issues. Rose said that PACE benefits are huge. The students have benefited personally, professionally. PACE addresses challenges and makes a difference. If PACE is removed from SCC, they'll have to find a new place. SCC is a good place because it's wheelchair accessible. Brent said the county should be asked to continue PACE, that the BHASO should advocate for its continuation. Brent said that if PACE is discontinued, SEER may be discontinued also. Next CCP meeting will be held online on Monday, January 13th, 2025, from noon to 1 p.m. Meeting was adjourned. And those are my notes for CCP.
Thank you, Tom. Any questions for Tom or comments? No, Tom, thank you again. I appreciate that.
You're welcome.
All right. Let's move on to section of board comments, and we need to do chair and co-chair elections. So I'm going to open up the floor. Is there anyone expressing interest in either chair or co-chair position for this calendar year? Keep it down, folks. Can't get to everyone at once. Shane or Gail, what are your thoughts? Are either of you folks interested?
I don't know that I could. I just, it's not the right time for me.
Okay,
Yeah, I'm gonna be traveling, Kim. Like I would volunteer to co-chair, but I can't chair because I don't know that I'm gonna make all the meetings.
okay. Anyone else? I mean, I'll just say that I'm certainly, I'm certainly willing to continue to chair. In full disclosure, I mean, I have chaired, to be honest, over the course of I don't even know how many years I've been with the board. I want to say 10 to 15. I've actually chaired multiple times. So I certainly would like to share that opportunity with other folks, but I am willing, the absence of individuals willing to do so.
Kim, I nominate you for chair and I'll volunteer as co-chair because we've been doing this since what, 2007?
Yeah, a long time. A long time. All right, we have, it sounds like not one nomination for both positions. Any other nominations or any other interest? Okay, let's then do a vote. I have up myself and Shane will abstain from voting, but the nomination is for Kim Taylor, myself as chair for this year, and then Shane Lindsley as co-chair or vice chair for the year. So all folks in favor?
Aye.
Aye.
Any abstentions or those not in favor? And again, I'm abstaining. I think Shane is abstaining, but any difficulties with those nominations? Okay, so shall it be? All right.
Congratulations again, Kim.
Yeah. Any additional board comments or questions? News for the good of the group? Public comments? Okay, hearing none. We'll meet again Monday, March 24th, 3 o'clock, same time. And may I have a motion to adjourn?
I'll move
Motion.
we adjourn. I'm
Second.
Second.
All right, everyone, take care. Thank you.
Bye.
Bye-bye.